Thank you very much for all the presentations. So we're going to take questions, and since our panelists were right on time, we're going to reward the whole group and have a 2:15 break for 15 minutes. So just warn you that that's coming up. But sort of as you ask questions, maybe I thought I'd throw out one I've been wanting to ask all day, and we sort of hinted at it before. But you know, we're good at finding people and places that are doing cool things. I guess my question is, are you guys like just very unusual in your enthusiasm and your, or is this sort of a little niche thing in your communities, or do you really see a movement of sort of a culture of more being concerned by this? And of course, again, I live in a city where there's been a big backlash saying, forget all this bike stuff, forget all this healthy stuff. We care about poverty, and that really defined the mayoral election in some ways. So I wonder, you know, yeah.
All right, for us, you know, I talked about mistaking activity for success. The city of Cleveland, we have about $9 billion of investment activity happening citywide, which is significant, particularly in these challenging economic times for a city like ours. But our mayor is sort of moving to this ideology of human impact. And we are really looking at, you know, what's the purpose? We got $9 billion of investment. Why are we doing it? And it's really about people. And the focus on the human condition is something that we're really trying to kind of really pinpoint. And I can appreciate the young lady's slides from Chicago, because one of the things that we're really trying to do is, using GIS, is to really map and understand the conditions that exist in place, the human condition. And because we have a robust medical system, good health departments and institutions of that nature, we're able to really sort of capture and understand the conditions on the ground from a human standpoint, and really respond from a land use perspective. It actually gives us as planners the why we do what we do, when before we really did not take it into consideration. But go figure that zoning and planning's roots were rooted in public health. So it's a rekindling of a marriage that somehow over the years just kind of, you know, for some reason or another fell apart. And here we are now, full circle, really starting to sort of work together with our health departments and medical institutions, and really begin to sort of rekindle that marriage.
Thanks very much. You know, I think that, well, first, you know, I try to come from the perspective of the, you know, the full state of Massachusetts. And so, and we are really focused on not just being about Boston, not just being about the urban areas, but being about the entire state. And I think there are a lot of other states that that are, you know, we like to think that you know, as our motto says, we lead the nation in transportation excellence, but we're not the only state by any means. California, Washington, Oregon, Maryland are really you know, doing a lot of similar things. But you know, we do hear some backlash within Massachusetts. You know, concerns about, you know, wasting money on, you know, projects for bicycles and things like that. But you know, we feel that offering transportation choice and safe transportation options is not a it's not a bell or a whistle. It's a, you know, it's essential, and that we're very focused on giving people the transportation choices that they have demonstrated over and over again, you know, voting with their feet, as it were, that they want.
So, I mean, clearly there is an enormous amount of activity happening, school districts across the country around promoting healthy eating. And there's clearly a lot of activity happening across schools across the country promoting healthy eating and physical activity. We have a very strong cheerleader in the White House, and there are a lot of foundations and other people interested in funding that work. Chicago is by no means alone in that. I think the concern that we should all have is what happens when that leadership isn't there or when that funding isn't there, and really trying to seize the moment that we have now to really figure out how you integrate that into really the core of education metrics and accountability and professional development, so that when that excitement, when those dollars disappear, it's really become embedded in part of what the education sector understands they need to do to achieve their goals. The work that we do, I'm very happy to say we're not alone. It's not a crowded field, but we are seeing Kaiser just funded a big project with the Colorado State Board of Education around creating health metrics for them. I just talked to the California Endowment, and there's some interesting work going on in terms of incorporating health metrics there. So it's not an overcrowded field. We'd like some more company, and I think we're trying to bring people together to really try to do some best practice, some thought leadership on how you create those metrics and how you do it, because even when we get, we're at the table with the State Board of Ed talking about this, it's a challenge to figure out the metrics, and working with others who are thinking about that and coming up with some, good ideas and validated ideas, I think is really important at this point in time.
Well, one thing at the moment in time, when we started doing the recipe, we were looking at also what happened to when Jane Addams was in Chicago, and it was all about the sanitation, right? That also made sense. Oh, they decided they needed to have clean places for the kids, so that's why we have more field houses than any other city in the country. I mean, we have less parkland, but we have more facilities, partly because of Jane Addams and what she was trying to do for the immigrant population through public space. So I do think there are periods of time, and you have to seize upon the interests of the politicians, and you have to kind of build that out as their legacy, because they don't get paid they don't spend as much time thinking about that one thing. They have all kinds of things. So it's sort of, I always feel like the bureaucracy's job to kind of build that out for them, because otherwise it'll just be, well, I did that. But again, I had experience working with one strong mayor and now another one who both had things, and then we try to build that out into the bigger movement, and so that that everyone starts to understand that it's a movement. It's just not a green roof.
Yeah, hi, Mayor Sash again. Just one historic comment. I think one of the reasons why we separated land use planning and public health is because of antibiotics. We were so close together because of sanitation and communicable disease, and when we kind of thought we had conquered communicable disease, now we obviously have antibiotic-resistant diseases, but for a while there we had a window of success that we drifted apart, and now we've got chronic disease, and it's bringing us back together, so we're in a new field of public health ourselves as we do chronic disease. I just want to give a plug. We at Change Lab Solutions have tools for all of the work that particularly Freddie, and I'm sorry, I don't know your name, from Chicago, Land Use Planning Chicago. We help work on the food plan, and I want to just give a shout out to that. And there's so much tools ready to go for communities to do this work and on the web, downloadable. I think the challenge that we're having in public health, and I'm wondering if any of you are working on this or if other people in the room, is how do we connect this type of really grassroots, changing the infrastructure of our communities to the Affordable Care Act and disease prevention, and as we start ensuring, hopefully everybody, and eventually immigrants too, that we'll go bankrupt if we don't prevent disease. We have to prevent disease, and these are the tools to prevent disease. And how are we going to make links between all this fantastic work and the fact that we're spending way too much money for terrible health outcomes in this country, and now we're insuring everybody, if we don't change, it's not sustainable. And I'm just curious how we're going to grapple with that challenge. And I don't know if this is the panel to discuss that, but I'd love to hear other people's thoughts too, including yours.
I mean, we're very focused on that question. We think that schools can be very, very important parts of community care, a very important place where screening, chronic disease management, prevention, health promotion can take place. But we have right now a funding system that is asking education sector to primarily fund all that, and there are real barriers that exist at federal and state levels that make it harder for schools to access health sector resources. So we're really looking at trying to get some of those federal regulations changed or clarified. I mean, some places it's just so mushy, no one's doing it. Some places it just needs to be changed so that there's more access, so that schools can access health sector dollars.
I'd just like to, on behalf of the roundtable, just say, I mean, that question is a question for our whole work this 3 years, major parts of it. And our last workshop was on ACA and population health, possible intersections. And that report will be available soon, not answering that question, but dealing with it. I actually spent all day Tuesday with a group working with CMS on the state innovation models for health reform, and specifically how social determinants might be incorporated into that sort of health reform thinking. So, I mean, there's just a lot. It's a big question that you ask, and we're all, this roundtable is about that, in addition to other things, big time.
I would just say in that, we would not have done the Recipe for Healthy Places plan if the CDC hadn't funded, hadn't thought, I mean, we wouldn't have done it. It wasn't on my work plan to do that kind of thing. So, and I don't think I would have gotten like corporate dollars to do that. Because, you know, so getting the, and again, this planning money is not that big compared to like other kinds of interventions. The fact that we got it from the CDC sounded really impressive. So, hey, we got federal money to do this plan, and so it gives us this sort of cachet, and frankly, we would not have done it, because that's just not what we do.
Well, that's, you know, that kind of, you know, that's talking about like sort of the new money thing that versus old money that Jennifer Ho was talking about earlier. But you know, I'd like to you know, have a little bit of a, you know, counter perspective on that, because, you know, new money, you can focus on something, but your new money, let's face it, in the environment that we're in, is going to be small. It's going to be limited in geographic scope, and it's going to be, you know, you're going to be piloting and case studying, that sort of thing. Old money, you know, that's sort of where the money is, and I, you know, I come from the transportation perspective, but, you know, the education perspective. There's a lot of old money in those sectors and in other sectors, and if you can figure out a way to use that old money a little bit differently, a little bit smarter to promote health, that's a really big lever.
Ray Baxter from Kaiser Permanente. I have a bit of a different question, and I started thinking about this in the first panel where we had 4 government agencies, and you're not all in government. I think 3 of the 4 of you are, but you're all concerned with the public sector in an important way. And that is what no one except DOD has spoken about yet, is that the public sector has enormous purchasing power, and it has enormous employment effect. So those are 2 gigantic levers that can be used to improve health. And my question is whether in the work that you're doing, whether government at the city or state level in the way is in any active way focusing on their power as a purchaser. I don't mean a purchaser of health benefits. I mean a purchaser of food, of land, and so forth, and its role as an employer with hundreds of thousands of workers who could be healthier than they probably are at this point.
The former, no. The latter, there are some inroads in the city of Cleveland, but I would like to highlight a local hospital system in Cleveland that has been a leader with changing policy. The Cleveland Clinic, many of you may be familiar, Dr. Toby Cosgrove made some very aggressive steps to ensure that his employees are healthier with a lot of backlash. But he did some very aggressive things, and he banned some things on their campus, and that was huge. The mayor and the 4 hospital systems has partnered recently for this Healthy Cleveland initiative. That ideology of aggression has spilled over into the city of Cleveland, where we began eliminating sugar-based drinks from all of our vending machines, and doing some very practical things to try to curb sort of this, the health outlook for our 8,000 employees that we have. So we're moving in that direction. But again, I think one of the things that all of us have to do in this work, even when we make strides or we hit milestones, we have to understand that onboarding and education is constant. And you always have to continue to sort of bring people up to speed. And I've watched some of our local officials transform in the last year and a half, where they were one place in the conversation and their maturation has been tremendous. And that's because that consistency of education and dialogue with our County Board of Health, with our Place Matters team, and it's just this persistence. And sometimes you get tired of it yourself, talking about it. But it goes a long way to really creating that systems change. I think another thing that's really important, if you really want to influence, is institutionalization. And when I talk about institutionalization, like we talk about HIA, for example, we just got a grant from the Pew Charitable Trust to do health impact assessments, well, build capacity in our agency to do them. We actually successfully did our first health impact assessment on a zoning policy called the Urban Agricultural Overlay District. And this zoning policy would introduce intense farm uses in an urbanized environment. I'm talking about goats, chickens, and bees. So we can imagine the unintended consequences of a policy such as that. So although popular, they were not considering the potential adverse impacts. So it was the perfect HIA to do, and we successfully did that one. But I think that as we move forward, and we as a planning department begin to really start to institutionalize healthy community design checklists, things of that nature, try to focus on what we can control and master it. And I think if other sectors begin to sort of understand first the big picture and then creatively infuse that into their vein of existence or operation, you'll start to see a system shift. But this is why that master conversation has to be digestible enough for people to get it. And I think that this is this forum, I think, is really, really good. I did not expect to hear the depth that I heard today from you guys. No offense, but it's been interesting, and it's a testament of how far this movement is really going. So I'm just delighted to just be a part of this.
I just want to say we don't allow four-footed things in our urban ag ordinance, and actually it wasn't because of it. No, oh, okay, any animal. If you saw aquaponics, that's fish. But we didn't do an HIA on that. But we had urban ag advocates say, no, you got to do this. But people in the community, not so much. So it was, it's like you have to talk to a lot of the constituents about anything. And so just because you have an idea doesn't mean that where you want to put it, like people want it. Right. So that was no. And some of the aldermen, absolutely.
We, with the Commonwealth of Massachusetts employees, we do have a lot of programs. The Leading by Example program that I mentioned really does promote, sort of environmentally sustainable and healthy purchasing decisions and travel decisions, and just the way you go about your business. Think with a lens of doing the right thing, promoting the right outcomes through your actions. We sort of bolster that within the DOT with our Green Dot policy that has some very specific, we have an implementation plan that includes a lot of very specific measures, including procurement and decision making, not just on design, but purchase and that sort of thing. We don't have any chicken related policies. We do leave that to the cities and towns. I have some that live around the corner from me. I'm not sure whether they're sanctioned or what, but.
Thank you all. Martha Gold. This is sort of directed first at Rochelle Davis, but it may be to a broader group. You know, as the roundtable is thinking about where we want to put our efforts, we've been talking about, you know, building movements around population health. And we've been thinking about the different constituencies. And one logical constituency is school-aged children. And as you talk about the kinds of things that are going on in school health, there's a lot of emphasis on sort of changing the environment in which children are learning. But I'm also wondering, I guess I'm fresh from reading an article in the New York Times a couple of weeks ago about social intelligence, emotional intelligence, and the kinds of ways that has been found to equate with success later in life. And there are some very interesting stories about having young people really share experiences that are difficult emotionally for them. I'm wondering whether you're aware of anything that's going on in school systems where children are talking about the experience of being ill. I was just sort of thinking about, you know, back to having chicken pox. And, like, do people sort of, are there programs that you're aware of where children are sort of faced with this notion of the value of health and have conversations about that? Because that would be a great constituency to sort of bring on board early along.
Not in the work that we do, but I'm not sure that it could be going on, and I'm not sure that we would necessarily come in touch with it. In Chicago, obviously, a big concern that we have is the violence that our children face. So there's an enormous amount of work and a huge effort going on within schools and communities in Chicago to help children develop different ways of expressing themselves, and also to help children who have been subject to bullying or violence, or who have seen it in their homes and their communities, deal with that. And I know there are a whole host of programs both in schools and in communities around that particular issue, but I'm not aware of others. But it may not have, it could be there and we may not have come across that.
We actually do a lot of work with schools and with school kids, and we do our best to not brainwash but educate children on the importance of healthy transportation. We have a statewide Safe Routes to School program. It started out as a federally funded program in 2005, and we have, really focused on that program. We have a staff of I think 5 who just do Safe Routes to School in the transportation department, state transportation department, who do outreach to schools, and they go out to the schools. Each one has a region of the state, and they go out and meet with partner schools. They do pedestrian and bicycle safety training and education on the importance of walking and bicycling and getting exercise, and how they can do it. We run special events where we have walking school buses and International Walk to School Day. We have also a whole additional program where we do in-school assessments to identify infrastructure deficiencies, safety and access issues that prevent kids from walking and biking to school, and we actually do infrastructure projects to improve walking and biking access to schools through the Safe Routes to School program. And we have 625 partner schools, which is 42% of our elementary and middle schools in Massachusetts. In 171 cities and towns, that's about half of our cities and towns, and it's we reach 279,000 students in those schools, which is about 44% of our student body in elementary and middle schools in Massachusetts.
Can we take Terry's question, and then we'll go to the folks online?
Thank you for your presentation. I'm just listening to, you folks are the believers, I think, and you've incorporated, one way or another, you've come to see value in incorporating health into the work that you do and the connections. I'm sure you're presenting to your colleagues in transportation, education, and planning these concepts. I'm just curious to know what you think has the potential, maybe something you're doing that has the potential to go to scale, that has implications nationally that you think, in the way that community gardens have proliferated around the United States and continue to do so. What are things that, or something, at least in these sectors, that you think might have the opportunity to be taken to scale? Thank you.
Well, if I were to pick one single thing that's really foundational and that works, I think at the local, state, and federal level, that is really a complete streets approach to designing our transportation system, designing and operating it, because I feel like everything else really flows from that. You say that every dollar that we spend should promote access and safety in all modes to provide people with the transportation choices that they have shown they want. Yes.
Okay, from online, please comment on the present and anticipated workforce capacity, training numbers, distribution to affect health and all policy and health impact assessment work by sector.
Well, I think it's an interesting question. I don't know if any of the four of you have health backgrounds or that way, and I guess the question is, do you think you need that, or your successors need that, or is it better that you don't have it?
Well, I think that needs to be part of a team. So I don't think that anything we do of any scale is something that like one profession does or one individual does. So it's got to be part of a team. And I've run into this with arts and culture. Like, you guys got to incorporate arts and culture in your planning. Well, okay, we're planning. You're the arts and culture. You need to come to the table and spend the time and talk about it, figure out how that fits. So I think that well, obviously not a health professional, but I think the health professionals can be a part of that process, and you don't have to be trained in it. In fact, I don't know, you have to merge those disciplines, because a health professional doesn't do land use planning, so what are they going to know? But by talking about these things, we can maybe figure something out. So I think it's got to be a team.
If I understood the question correctly, it had to do with building capacity, right? The amount of workforce that it would take to ensure that HIA can go to scale. Well, I would answer that this way. It's really not about building a new workforce around HIA. It's re-examining our existing folks who work in these sectors and getting them to operate differently. And I think that HIA is a methodology for doing so. So HIA has introduced a new method for engagement for me as a planner. So it wasn't an additional person added, but it was a rethinking about how I did my business. So it's really one of those things where we have to embed this health and all policy into the DNA of organizations and the people who work in these organizations. So it goes back to changing the value proposition. And I keep bringing that up because that's the impetus for it all. The reason why we have disparities is because our values are jacked. So the question becomes, how do you reframe the value proposition? And I think by like the work that Kathleen and those folks are doing over in Chicago, some of the work that's going on in Cleveland and Ned is doing, I think what that does is slowly changes the value proposition. And I just want to give one example that I think is really a hallmark, which is, how many of you are familiar with Jeffrey Canada, the Harlem Children's Zone? Oh, well, it was the Harlem Children's Zone because it's a place. And he created the conditions for success for those kids. So that sort of scenario is really a model that we all need to follow. It's how do we create the fair conditions. I mean, many of you come from or live in communities where people thrive. They're stable, they're affluent. The folks who live in some of the worst neighborhoods, believe it or not, they want the exact same thing or have the opportunity to compete for the same thing, you know? And I don't know whether it's a scenario where it's just gross capitalism, because there was a time where, you know, capitalism created opportunity for folks, you know, and now it's just sort of become out of whack. And it's become a scenario where people are shut out from the opportunity to compete. I'm a capitalist. I believe that, you know, if you work harder than him, you should have more. But if I create a situation where only you can compete and he's not even in the game, that's not fair. And I think this is where the conversation needs to start to happen. We need to create a scenario where you two should have an equal playing ground to compete, and that's not what we're doing. And that's why this health lens, I think, is so important, because it brings that fairness, equity question really explicitly to the forefront, and it provides an evidence base that does not exist. Because most of the time when you're talking about equity and health, you know, people are looking at, oh, he's an activist, or they're angry. No, these are the results of that. So this is why I think for, I guess, us in the planning community, why it's so important. It really starts to add a level of substance to my work personally that didn't exist for the 14 years I've been a planner.
And I would say it is about like adding substance. So I have to say, sort of the planning bureaucrat, when you're telling, if the language about this HIA and the health and all policies comes out as, you guys have to put this into your work, that's really annoying. Because it's like a teacher being told, now you have to teach more subjects, right? You have to add this to your work rather than, okay, I got enough already. I can't just add it to my work because it's important to you. And it's not that it's not important to me, but it's how do you become part of the team and not saying, here, you guys have to do that. We both have to understand, and it'll be easier. But you can't just force it on and say, here, you guys got to do this now because there's a crisis. There's many crises.
Well, and I think it's being willing to listen to how things that are sort of, you know, outside your particular sector actually are not outside your sector. They are actually at the heart of your sector if you understand it, and how those connections are made. Like Captain Ellenberg said this morning, you know, I'm very happy to listen to experts and try to learn enough from them to be able to understand how that affects my work and the core of what I'm trying to do, and not to. I mean, I think that a lot of the problems, and I'll talk about the transportation sector. A lot of the problems that we're trying to overcome now in the transportation sector, the way things were built, promoting sprawl for many decades, resulted from a sort of a siloed perspective, an unwillingness to think outside your particular sector, your silo, and the unintended consequences that result. I mean, we all have the experience of, you know, being in sort of an old city or town that's very walkable, and that, you know, you're like, oh, this is a great place to be, as opposed to, you know, maybe you walk out of that part of the, you know, the old city into urban renewal zone, and it's terrible. You feel awful. You feel unsafe. It's just, it's nasty. And you can understand that. And that's, you know, planners and transportation engineers not thinking about how their actions affect the broader environment.
Okay, before I turn to Mary, I'll say to Dr. Kaplan that he doesn't have to worry. We're not going to ask the federal government for a doctoral program in health and all. So you can relax. Yeah. Mary.
Sure, thank you. Mary Pittman of the Public Health Institute. I currently live in California, but I used to live in Chicago, so I'm pleased to hear about the progress that you're making. We've had great panels today talking about intersectoral, multi-sectoral work, particularly across government agencies. Could you talk a little bit about how you're engaging the business community so that you don't get the pushback that we're putting too much regulation and defining how business has to fit into this effort to really build healthier communities? Are they buying in? How do you get them to buy in? And what could you share with the rest of us?
I think a pretty short answer, because I think in Chicago there's a very strong sense that our schools are not working the way they need to, and that impacts the business. So we have a Civic and Business Advisory Committee, and we have, we have a lot of corporations that want to come to the table and want to understand the what they can do to really improve the school. I mean, I think we have one just on the intersection between education and health, but I think the corporate community clearly understands in Chicago that it needs a better education system in order to have workers that want to live in the city, in order to really have their businesses be successful and succeed.
In your definition of business, would you consider a developer or the development community business? Because I would. And I think one of the things that we actually have a kind of real life example of how we had to, and I hate to use this term, kind of sell this notion of health as an opportunity, because they only could see profit and not people, because the bottom line matters to developers. So part of the work that we've done with this developer recently, in order to get him to sort of buy in to the health enhancing recommendations that we were giving him for his development, was for him to be able to promote his development as a healthy development, as a marketing tool. He had to see the business proposition in what we were stating, and it was a strategic approach that we took that worked, ironically. It didn't go to the depths that we wanted, but it was a huge step that he listened and considered it. And this same developer is going to be a part of our focus group for the next HIA we're doing. So that's huge. So I think meeting people where they are, and sometimes that's boosting an ego, showing the business proposition, and just really taking a very creative approach. And that's going to be unique to all of you, depending on who you are, how you're working, and who you're touching. I think there's creativity and innovation in this. Everybody always is looking for the next model or the best practice, but I think this is a renaissance time, and in a renaissance time, creativity is required. And the thing about innovation, there's no model for it. If it's really innovation, there is no model. So I think sometimes you have to just kind of do what's relevant for what you're doing, or what's relevant for your place.
I'll say just quickly, we work a lot with the business community, and I think in Massachusetts, to a large degree, a lot of them are sold on sort of walkable communities with transportation choice. Where do all these businesses want to locate? They want to locate in Kendall Square in Cambridge, and in the Seaport Innovation District in Boston, very urban, walkable areas with a lot of transportation choices. Every mode is available, and I think that they understand that. Are they, do we still have some education to do on some specific things, work with developers to push them a little bit on making sure that they build the infrastructure right, make sure that they institute the travel demand management policies to try to encourage people to get out of their cars? Yeah, it's an education, it's a regulatory role that we have, but it's one that we're committed to and that is in keeping with all the rest of our policies.
Great, thank you, Brian Sakurada, NovoNordisk, and again, I wanted to thank all of you for your great presentations today. They have been very enlightening, and I'm always enamored on the the ingenuity that people have in the community-based programs to improve population health. My question kind of started this question, but I maybe make it a little more specific around, is there opportunities from the healthcare industry for partnerships to help community-based projects? And I'll give you an example. At NovoNordisk and other healthcare organizations, we continue to support the National Diabetes Prevention Program, which, as all of you know, and it's mentioned several times during these formats, approved through the healthcare reform administered by the CDC. And through that, we've been able to provide scholarships to particular cities so that they could reach individuals with prediabetes and diabetes. Are there opportunities specifically for that particular industry to partner with all of you, or in helping and improving population health in those community-based situations?
Sure. I mean, why wouldn't that? Yes, there would be. And I think in the city of Chicago, it's better for us to partner with partners in the community, and money always go to the community. It's just a lot easier. I mean, it's very difficult for the city or someone like me to spend money on things like that, but it's much easier for me, not me particularly, but my division, people I work with, to partner with the communities to do things. Basically, the money for these plans that we've been talking about, the money went to community organizations who did the public outreach. City, not so good at that, but the community, the money goes directly to them. They do that kind of thing. But I think, we do run into like money going to organizations, and then it's better if they're all at the table, so that like the government and the community and the funders are all kind of have the same general direction. Otherwise, you just you'll have more impact.
So, I mean, I'm one of those community organizations, so, give me your card and we can talk. But, I mean, very specifically, we've created the Civic and Business Advisory Committee very specifically to invite both political leaders, even those that aren't directly connected on the school board, aldermen, state reps, they all have a vested interest in schools and in health, and to invite the business community, whether it's, a health-related company or not, to be at the table and to hear about what the plans are and what the strategies are, to contribute what knowledge, expertise they have, and to see where those intersections and connections are and where the resources that they have can best be used. And so, that we're specifically set up to try to make sure that those opportunities can be figured out.
Great. Thank you.
Okay, I think we will take our break now, and I want to really thank our panel. Excellent questions. So the plan is to break now and to start precisely at 2:30, as George would say.